Complications associated with amniotic fluid. I'll talk about two conditions. First, the maternal complication called amniotic fluid embolization, which is characterized by sudden cardiovascular collapse, and also there will be acute respiratory distress syndrome, as well as DIC. This management of this syndrome requires a multidisciplinary team. Diagnosis can be done on an ECG, which will show a right ventricular failure, and treatment involves mechanical ventilation, cardiopulmonary resuscitation, transfusion, and the use of inotropes plus pulmonary vasodilators. Transfusion should be done in a 1:1:1 ratio, involving red blood cells transfusion as well as frozen plasma and platelets to correct the DIC. Cryoprecipitate can also be used when needed. In severe cases, extracorporeal membrane oxygenation can be implemented. And for fetal complications, I'll talk about twin transfusion syndrome. This is seen in monochorionic twins, where there are aberrant placental cells which are shifting blood from one twin to the other. The hypertransfused twin will develop polyhydramnios and cardiac failure due to cardiovascular system overload, and the hyperperfusion can also lead to the twin being hydropic. The hypotransfused twin will have intrauterine growth restriction associated with oligohydramnios and anemia. The condition is lethal to both twins if left untreated. And for treatment, the management has to be done intrauterine. So surgical ablation of the aberrant cells can be done, followed by intrauterine blood transfusion of the anemic twin and amnio infusion. The fetal loss is always a risk. Fetal loss for both twin or one of the twins is a risk. Okay. For references, I used Williams Obstetrics 25th edition. And I also read on the amniotic fluid embolization successful recovery by H-Gang 2019. And also I used the amniotic fluid embolization principles of early clinical management by Pacheco et al. 2020. Thank you.